Hi, today we're going to talk about carpal tunnel syndrome, the cause, and the best type of treatments for it. Okay, first of all, we're going to discuss a little bit of anatomy. I don't want to bore you too much, but we'll just basically touch upon anatomy or superficially touch upon it. And we have a nerve. Now, what are nerves? Nerves are extensions of the brain. The nerves travel through the spinal cord, and after they pass through the spinal cord, they exit from the spine, and they travel to the various parts of the body, the periphery of the body. The nerves travel to all of the muscles, organs, and tissues in the body, and they tell each part of the body what to do and when to do it. Or I should say, not they tell, but they instruct through the brain. The brain is actually controlling every single part of the body. Okay, so we're talking about the most distal or the most peripheral portion of the nerve. The median nerve travels down the forearm and it goes through the wrist, through a small hole, and that hole is filled with 9 tendons and a transverse ligament as well. So that hole is very tight. There's not that much room. Here is, you can't really see it as clearly, but you have a bunch of nerves that go through the forearm, and one of those nerves, so-called the median nerve, travels to the palm, the thumb, the index finger, and the third finger. Again, another picture where you can see the median nerve traveling through the wrist. You also have the ulnar nerve traveling through the wrist as well, and the ulnar nerve goes to the ring finger and the pinky. So that median nerve is, again, arising from a branch of the nerves in the neck, and they travel down the arm to the forearm and into the hand. And that the ulnar nerve supplies half of the ring finger. Okay, so half of the ring finger, actually the inner portion of the ring finger and the entire pinky finger, including the inside portion of your palm. All 3 nerves, which you have the ulnar nerve, the median nerve, and the radial nerve goes to about 1/3 of the back of the hand. Excuse me, and that's rarely injured because that nerve is pretty deep. So carpal tunnel syndrome consists of a space in the wrist that houses 9 tendons and is surrounded by carpal bones and the transverse ligament. Carpal meaning wrist. It's a Latin term meaning wrist, and therefore the tunnel is a hole, so carpal tunnel. Right? So you see the median nerve traveling through, you have a very thick transverse ligament, you have these 9 tendons. By the way, tendons connect muscles to bone. Ligaments connect bone to bone. Purpose of the transverse ligament is to hold everything in place. So again, you have the median nerve traveling just underneath the transverse ligament with the 9 other tendons and the ulnar nerve. So pain, tingling, numbness, the first thing that usually happens is tingling and numbness. You can get pain first, but I would say in the majority of the cases, it's usually tingling and numbness that develop first. And that tingling and numbness will typically be in the palm, and then in the thumb and the index finger and the middle finger. Eventually, if it's not taken care of, and a lot of people figure, they shake it a little bit, they get up at night, they have to shake their hand, they feel a little bit better, they go back to sleep, and they keep putting off treatment. They keep putting off going to a doctor. So what happens is 3, 6, 9 months pass. As these months pass, what people don't realize is that the nerves are not receiving their proper blood flow, and therefore the nerves start to die off. So all of those little wires that are traveling through the nerve, called axons, are starting to die off, and they don't realize it. When enough of them die off, that's when you start getting muscle weakness. And once you have muscle weakness, now it's a different ballgame, because the decompression, okay, the removal of the inflammation has to occur as quickly as possible, because otherwise there could be a permanent atrophy of those muscles. Analgesics and anti-inflammatory medication is the primary medical treatment for this. The reason why it usually doesn't work, if it does work, it's temporary, is because of the fact that there's inflammation, which I didn't mention. Why does the inflammation begin in the first place? And it has to do with those tendons. we're constantly using for the finer movements that we do, whether it's hammering a nail, screwing a screw in or out, tightening nuts or bolts, knitting, even things such as washing dishes, of course computer work these days, typewriter in the old days. All of these things will constantly put stress on our muscles in our forearm, and then those muscles, what do? They pull the tendons, and the tendons eventually become inflamed. And when the tendons become inflamed, there's not much room for that inflammation. It's a swelling, and there's not much room for it because you have that tiny hole. So the tendons become inflamed, so what is it they're going to affect? The inflammation will affect the median nerve, and it also can affect the ulnar nerve in a smaller percentage of cases. So they give you analgesics, which is a painkiller to kill the pain, and anti-inflammatory, which helps to reduce the inflammation. But if you still have the problem there, if the problem is all of the work that you're doing, and sometimes you can't avoid that, then the inflammation builds up, and you have to keep taking the anti-inflammatory medication if it does help. Steroid injections, invasive certainly, and after the medication doesn't work or a person gets tired of taking the medication, then they'll give you a cortisone injection, which usually is not effective as far as the carpal tunnel syndrome, probably because there's not much room. There's such a great inflammation in a small area that it's too much for the medication to handle. Physical therapy, also not very effective for carpal tunnel. Physical therapy, exercising muscles, is not usually going to handle inflammation. They can do ultrasound and electrical muscle stim, diathermy, infrared. All these things are helpful, but they don't take care of the cause of the problem. And therefore, they're usually not enough to handle the inflammation. And that's why, in most cases, physical therapy is not effective. So surgery is something that they immediately try to jump to because surgery is somewhat effective. Okay? Number one, it's invasive, but number two is there is failure and complication rates in studies anywhere between 3 and 19%. Okay, so what happens is, what do they do in surgery? Well, that transverse ligament, they actually cut it. They cut the transverse ligament, and what that does is that now exposes more of the tunnel so that there's more room for that nerve and more room for the inflammation to get dispersed. Okay, which is great, and it will relieve the symptoms in just about every case. Okay, if this is the cause of the problem. So great, that does help to relieve the problem temporarily. But a few things. Number one, the ligament can grow back. Okay, and number two is you can get scar tissue. And when you get scar tissue forming, then what happens is that scar tissue can then directly affect the nerve again. Now, scar tissue will result in any type of surgery. With some people, scarring occurs more often than in other people. So you can get scarring. So what do they do for the scarring? They open it up again and they remove the scar tissue, which causes even more scar tissue. So it's this endless loop, so to speak, that's why people sometimes will have 2, 3, 4 surgeries. Now, the thing about what I do is low-level laser. And low-level laser, what it does is it increases the blood flow and it helps to take care of the inflammation naturally. And that's what I like about it. And then after I do the laser on people, reduce the inflammation of the tendon and the nerve, then we do some trigger point therapy. I give you some exercises, basically, which is called trigger point therapy, to do at home, where you actually work on trigger points in your forearm to help to relieve the stress on those tendons and calm the area down. I also give you stretching to do as well, okay, because we want to stretch out those muscles in order to help to relieve the pressure on the nerves. And we want to, lastly, we want to mobilize those carpal bones. What does that mean? Well, you have these bones called carpal bones in your wrist, and there are joints between those bones, and those joints can become fixed or stuck. So what I do is, by using my hands, it's a very gentle procedure, and I adjust those bones, I adjust those carpal bones in order to get them moving properly, get the pressure off of the nerves, and relieve the inflammation. Now, one other thing that I have to mention, okay, besides the localized treatment to the wrist, often, not all the time, but often what happens is, remember I had said that that median nerve is a branch of a plexus of nerves in your neck. And what could happen is you could have bones out of place in your neck, and when the bones move out of place, they can narrow the size of the hole where the nerve exits from and pinch or irritate that spinal nerve. If just a portion of the nerve is affected, and the portion of the nerve that happens to go down your arm to the hand, it can cause or mimic carpal tunnel syndrome. It can cause tingling and numbness. Also, what I find is, especially with people in car accidents where they have an injury to the neck, what happens is we call it double crush syndrome. So the bone is out of place, it becomes stuck in the misaligned position, it irritates the spinal nerve, and it affects a portion of the nerve going down the arm, and you get carpal tunnel syndrome, okay, an irritation of the median nerve in the wrist. So what happens is the combination of the two kind of superimpose, and now you get symptoms coming from the shoulder all the way down the arm to the forearm to the fingers, which again the symptoms will be pain, tingling, numbness, sometimes weakness depending on the situation. So a person always, anytime I find a person with carpal tunnel syndrome, I always have to check them for a spinal problem as well, because they could be superimposed on each other. And again, we call that double crush syndrome. Very common in automobile accidents. So chiropractic care for this is most effective. There's no risk involved. It's non-invasive, and a person could always have surgery if this type of treatment doesn't work. The other thing that I want to mention as far as diagnosis of carpal tunnel, because again, what the average chiropractor sometimes will look at the spine and not look at the overall course of the nerves. And that's very important in this because of the fact that a person can have carpal tunnel syndrome and be misdiagnosed as having a neck issue that's causing irritation to the origin of the median nerve. So therefore the doctor thinks that the neck is causing the symptoms in the hand when it's actually not. And there's a diagnostic test that I do called EMG and nerve conduction studies, electromyography and nerve conduction studies. And what I do is I specifically test the individual nerves and see, number one, if the nerves are irritated. Number two, if the nerve is irritated, where is it irritated? Is it irritated in the neck? Is it irritated in the wrist as far as the median nerve? As far as the ulnar nerve, that ulnar nerve could be irritated in the wrist. It could be irritated in the elbow. You know when you hit your, what they call the funny bone, and you get pain, tingling, and numbness down the forearm? Well, that's what happens in an ulnar neuropathy. Right? So these are things that, that need to be checked when a person has symptoms in the arm, in the hand, especially tingling and numbness and pain.